Cool. Welcome everyone to the 2020 APAC Groundbreakers virtual tour by APAC OUC. And this year our event would be the biggest one ever done with 174 sessions. That would be including normal sessions, workshops and hands-on labs from 123 different speakers over 11 days. Also, it would cover sessions on 4 different languages. So please remember to register to as many sessions as you can. And all the sessions would be available to replay as many times as you want for 2 weeks after the initial session date and time. You can also interact with the speaker at any time during that 2 weeks by posting questions or comments directly in the playback session page. Now, I would like to give thanks to all Oracle user groups and Java user groups that made this event possible, and also to our sponsors, Oracle Crowd, Groundbreakers, and CloudDB. Now for today's session, Intelligent Infection Control Risk Assessment by Dipali Saraswat. Please feel free to write questions at any time during the session at the Q&A tab of the Zoom webinar, and the speaker would be answering them at the end of the session. If any issues during the presentation, please feel free to contact me at any time on the chat tab of the Zoom webinar. Now, without any more delay, I would like to leave you with this amazing session by Dipali. Take it away, Dipali.
Thank you, Nelsie. Hi, everyone. I'll just share my screen. Yeah. Hi, everyone. My name is Dipali Saraswat, and I'm part of Oracle Application Development Team. I have approx 5+ years of experience in IT industry with 4+ years of experience in core development blockchain. I have expertise on Oracle blockchain platform and Hyperledger Fabric as the blockchain framework. I have presented my various other blockchain research papers in many conferences like Analytics and Data Summit, Open FinTech, Linux Foundation Summit, and then one talk by Google Developers Group also. So let's start directly with one of the very evolutionary topic today, that's the intelligent infection control risk assessment. So let's start by looking at some of the shocking statistics. So 41% of the patients were suspected in transmission of 2019 novel coronavirus through hospitals. Health-associated infections account for an estimated 1.7 million infections and 99,000 deaths each year. If we talk about cost, it is exponentially too high. Annually, non-medical social cost for health-associated infections ranges between $96 billion to $145 billion. As per the data reported by CDC, in 2015, more than 8,000 people died due to poor hygiene maintained by hospitals in United States. Health-associated infections also occur because of few devices which are placed inside the patient, and these devices are absolutely essential and life-saving for the patient. Example, endotracheal tube. Healthcare associated infections are avoidable, and to prevent these infections, including those antibiotic resistant, is a key priority for WHO. IICRA stands for Infection Control Risk Assessment. It's an evaluation of the impact of construction debris within a healthcare facility. So, we have the solution, but does all countries and every hospital following this? Missing precautions parameter by hospitals led to the widespread of COVID-19. No diagnostic tool exists as of now that can detect the relevant problems. There is a bigger setback as a financial challenge of $15,000 for just one assessment. It's more than 10 months into the coronavirus pandemic. Healthcare workers on the front line of the battle against COVID-19 say that they still face shortage of personal protective equipment, masks, ventilators, face shield. It seemed nearly every kind of personal protective equipment was hard to find when COVID-19 was first through epicenters, and medical supply chain failed when it was needed most. Now let's understand the organizations that are typically involved in infection control risk assessment. JCI, Joint International Commission, an international accreditation agency which ensures uniformity and standardization of hospitals. NABH, it's same as JCI, but they operate in India. Infection control nurse, the primary duty of infection control nurse is to prevent the spread of infectious diseases that could imperil the patient's life. VAS, value added services, they are the third party services which conduct the audits throughout. Let's understand how these organizations work to execute the ICRA today. In current process flow, three parties are involved to maintain the trust and integrity of assessment: a federal doctor, a value-added service auditor, and the NABH or JCI affiliated officer. They visit the hospital and perform a ballot-based assessment where they fill the 8 core competencies designed by WHO and take the photo-based proof per question. Once this assessment is completed, they send the ballot copy and the image-based proof to the envelope to NABH or JCI. For them, it takes approx 6 to 8 months to validate the assessment and grade the hospital. Plus, there is no transparency for other parties like Ministry of Health Assembly and WHO. Most importantly, this assessment happens once in 2 years and the amount of money spent on this is too high. Because there is too much manual involvement, it may lead to mistakes and corruption. And we all know poor hygiene leads to rich infection. Now we have understand the problem and challenges the healthcare industry is facing now and how the infection is spreading at a rapid rate within hospitals. Let's understand the solution what we have built to combat the current situation. Using Oracle technology solution, we have put a stop on prevention of these infectious diseases and also help hospital to maintain on-par hygiene standards. The business model based on our technology solution can improve every hospital's inventory management system for hygiene equipments along with keeping track of periodic assessment to be prepared for all endemic and pandemic situation as we move ahead. Healthcare supply chain management using blockchain would lower the cost, boost the hospital revenue, and improve the care quality. Now, when we are familiar with the concept of our idea, let's understand how the data is flowing from starting till the end. The mobile application will be connected to the object storage and Oracle blockchain platform. We are using object storage to hold the images and document proof uploaded by the nurse. We are using Oracle integration cloud to connect the object storage and blockchain together. The URL path of the uploaded document will be mapped with the questions in blockchain. With each multiple choice question, there is a score associated to it. The blockchain runs the algorithm and finally grades the hospital for the questions answered. Calculating all these scores, the final accreditation will be given to the hospitals. We have connected blockchain to autonomous data warehouse and we are using Oracle Analytics Cloud on top of ADW data for showing statistics to the authorities. The Apex dashboard for WHO, Ministry of Health Assembly, JCI or NABH will have a sight from all perspectives. And also JCI and NABH can approve or reject the accreditation based on the proof submitted by nurse. This process will provide real-time efficiency as the transactions are committed by blockchain. Some data flowing here, it's too confidential. So we have maintained the data integrity with IDCS on top of our solution. So we have built this entire demo and we have presented it to various authorities like CDC and NABH in India. The items stored in the hospital inventory have followed a proper supply chain as we have integrated the Oracle blockchain platform at every step whenever the item is exchanging hands. Let's see the demo now.
See the demo now. We have created a mobile application for hospital and nurse. All the transaction which happens within the mobile application are all integrated with blockchain, which provides immutability and transparent source of truth. Let's log in as infection control nurse. This is the home screen where if we click on the hamburger menu, it has options like my profile, my order, track order and sign out. My order and track order are mainly for the hospital where they can manage the inventory items. There is also a notification which will show latest notification, like now it is showing that assessment is due by July mid. Also, it shows alert from the inventory window like stock is running out. There are tabs for inventory, past assessment history, take assessment and dispute. Let's click on inventory. This will populate the field from blockchain where product ID, product name, quantity and cost. If we click on specific item, it will show the entire history like who was the manufacturer, distributor, retailer with timestamp and location. Let's go to the home page again and let's take the assessment now. The landing page for taking assessment will contain the core competency option. The core competencies are designed by WHO and every competency consists of some question. Let's select core competency 1. Do you have an IPC program? Let's select option A. Now with every question there is a field for an attachment which uploads it to the object storage. Similarly, the nurse will answer all the questions in order to complete the competency level. Let's check the past assessment history tab. This will contain a list of all the past assessment the hospital have taken and the status from JCI. Let's go back to home again and let's check the dispute tab. This will contain all the assessment IDs on which the dispute has been raised. For example, in this assessment, question number 1.A and 1.B on this dispute has been raised and the score is 2 for this question with the dispute that the hospital is not maintaining a proper IPC program. So such kind of disputes can be listed into the dispute window. Once the nurse submits the assessment, blockchain will run the algorithm and calculates the score and accredits the hospital.
Welcome to our public website for infection and inventory management control. The landing page tells us a little bit about what IICRA stands for. You can explore navigation panel and get to know more. Public health gives you insight of what's latest around the globe and how important it is to build a happy and healthy community. You can get country-wise details of healthcare systems and criteria here. Even more insights from WHO. In times of emergencies, you can check availability and book hospital beds. Know more about non-governmental organizations' role in healthcare and their funds. Here you can gather information about global organizations working for health and welfare, even the latest information on pandemics like COVID-19. Administrators can log in and access data which is not public and perform other administrative tasks. From this login page, any official from WHO, JCI, NABH can log in with their credentials, select their organization, which will take them to the OEC dashboard, where they can have a look on the state-wise hospital details on it. Hospital Referral Region HRR specifies a market within which people generally go to the same hospitals. If we click on any of this, it will filter the whole dashboard on that particular region where users can see details like total number of ICU beds, availability, population and other details. Also, if you right click on the same region and click on 6-month projection, it will redirect you to another dashboard which will give user next 6-month projected value depending on the historic data. Users will be able to see state-wise hospital details like address, phone number, if they have emergency services, and also the ownership types. If you can click on any of the states here, you can get the information right away. Also, this dashboard enables users to view some of the top hospitals of a state by their clinical outcomes, community engagement, safety domain, and efficiency score.
Now, when we are familiar with the concept and functionality of our demo, let's understand how the data is flowing. The mobile application will be connected to object storage and Oracle blockchain platform. We are using object storage to hoard the images and document proof uploaded by nurse. We are then using Oracle Integration Cloud to connect the object storage to blockchain. The URL path of the uploaded document will be mapped with the questions in blockchain. With each multiple choice question, there is a score associated to it. Blockchain runs the algorithm and finally grades the hospital for the questions answered. Calculating all these scores, the final accreditation will be given to the hospital. We have connected blockchain to autonomous data warehouse, and we are using Oracle Analytics Cloud on top of ADW data for showing the statistics to the authorities. The Apex dashboard for WHO, Ministry of Health Assembly, JCI and NABH will have sight from all perspectives, and also JCI and NABH can approve or reject the accreditation based on the proof submitted by nurse. This process will provide real-time efficiency as the transactions are committed by blockchain. Some data flowing here is too confidential, so we are maintaining the data integrity with IDCS on top of our solution. The items stored in the hospital inventory have followed a proper supply chain, as we have integrated the Oracle blockchain platform at every step whenever the item is exchanging hands. Our platform is fully automated, and the assets can directly be shared with anyone. This solution could accelerate the momentum that is needed to ensure that infection prevention control is implemented throughout the world, and hospitals can maintain their inventory in a better way. With this approach, we can stop the spread of infection and viruses from level 0. And not only this, with this approach, hospitals and NABH and JCI can save up to 60% of what they are spending now by manual assessment. Lessons learned from outbreaks like Ebola, MERS, SARS, and COVID-19 gives the importance of strong infection prevention control from global health perspective to prevent next epidemic. Effective infection prevention and control can lead to more than 40% of reduction of healthcare associated infections. However, implementing the recommended core component isn't always easy and takes time and commitment. But with our solution, this is possible even with limited resources. Countries and healthcare facilities, if engaged to do this, will reduce infections, ultimate the resistant, and save money. Most importantly, this will make patients safer and save lives.
Yeah, so that was the entire presentation along with the demo. So we are trying to reach out to various other authorities like, WHO, like because we have built a solution with the technology platforms and we can try to implement it in hospitals. Uh, do you guys have any questions?
Is there any question? I have one question though, Dipali.
Mhm.
How do you measure the success of the whole solution? Like what is the measure of success?
Yeah, so basically, the measure of success here will be whenever the assessment is being performed by the nurse, right? So we are getting them verified from the NABH and JCI. We are not just relying on the blockchain platform for the result itself. But, so currently, if you see what happens now, it takes like 6 to 8 months because the process is entirely manual, right? But with this, we can have those things automated within like we can cut down it from 6 to 8 months to just like a few weeks or just 1 week and get those rectification from the JCS or NABH whether the result is right or not, and then it accreditates the hospital.
Okay, cool. Do we have any other question? Yep, I guess there's no more question from anyone else. And yeah, I would like to thank Dipali for sharing that new solution for everyone else. And I'm pretty sure it's gonna be handy now that we have this pandemic and hopefully in the next coming years, there would be no more pandemic that's coming. But anyway, it's a good solution though, and it's a good start for
Mhm.
everyone. And yes, thank you for everyone as well for joining this session. Yeah, we still have few more sessions up until the end of the day, so feel free to register to all of them. And of course, you can always view the recording of this session in the Groundbreaker site. And you can always, if you have further questions, just drop a note to the Groundbreaker site, and definitely Dipali is going to be answering all your future questions. And yes, once again, thank you for attending and have a great day.
Thank you.